The ALICE research provides an important look at issues around equity for veterans. We find that many of the gaps that exist in the general population, for the most part, continue to exist among veterans. Specifically in terms of race and ethnicity, we found that American Indian and Alaska Natives, Black, and Hispanic veterans were more likely to be below the ALICE threshold than other race and ethnicities. Similarly, in terms of sex, we find some gaps that remain, but interestingly, as the military has opened up further and the number of females has increased, they still only account for 10% of veterans. The largest number of female veterans served in the post 9/11 era, but we see discrepancies in income and financial status across all eras. Next, we turn to Leadership Committee member Sherry Pickering, who works at the Montgomery County Veterans Coalition and has seen issues of female access to benefits firsthand.
When one has a mental image of a veteran, it is very often of an elderly Caucasian male. However, we know that veterans come in all ages, races, and religions. Women veterans are serving at record numbers, yet they are still not asked if they are a veteran. Approximately 2 million women have served. As this population grows, it is imperative that we are inclusive of women veterans. Women veterans struggle to access their unique medical needs, especially OB care. They have higher rates of military sexual trauma and PTSD. Like their civilian counterparts, they also struggle with child care both before and after school, domestic violence, and healthcare bias, such as heart disease and sleep apnea. All of our ALICE veterans need access to resources outside of normal business hours because they just simply cannot afford to miss work.
There was widespread need for additional resources during the pandemic for veterans, especially female veterans, specifically around services for education, supports for children and children's education, as well as mental health services. Next, we hear from Laura Whitfield, the head of Mission United at United Way Miami. She reports that the share of women reporting to her program increased from 19% last year to 31% this year. She also credits her team with taking women's concerns seriously. They help women access VA benefits as well as feel more comfortable presenting their military credentials. Laura also leads by example as a U.S. Marine Corps veteran.
We've seen an increase in women veterans coming to our program because many of them are single mothers with children in the household, and they are just needing connection to resources for childcare or employment, and also food assistance. We've seen a lot of food insecurity here, and a lot of those families that we are providing food assistance to are single female households.
Thank you for joining today, and I hope it's just the beginning. Veterans are an important part of our community, and we've all benefited from their service and sacrifice. We look forward to working with you to ensure that all veterans can meet their basic needs and support their families.